Hello, my name's Juliet Finney and I am the clinical lead dietitian at Oviva for our Tier 3 weight management programme. And we're talking today about the importance of Tier 3 weight management programmes and the importance of making these accessible and appealing for patients to attend and participants to take up the offer of Tier 3 weight management in order to really optimise engagement and optimise outcomes from these programmes. So we know that Tier 3 weight management programmes can have a real impact both on clinical outcomes, whether that's weight loss and other clinical parameters associated with that, but also quality of life for the person living with obesity. And they can make a real impact on how someone feels day to day and their motivation to continue with their healthy lifestyle choices too. In our Tier 3 weight management programme at Oviva, we see an average of 6.3% weight loss, and that's including all patients in all pathways. We see greater weight losses in our GLP-1 patients and our total diet replacement or TDR patients as well. But it's difficult traditionally to get people to attend Tier 3 weight management services, and then after that to engage over the full 12 months that's needed to provide a comprehensive Tier 3 weight management service. And if we think about traditional services and some of the barriers to uptake of those, there are multiple barriers that need to be addressed to really support good retention, good uptake and good engagement. One of the potential barriers is patient concerns about group care. So many traditional Tier 3 weight management services are delivered in a group setting, which is fine if that's something that you would like as a participant. And for many people, groups can work really well. But for others, they may prefer to have one-to-one care. There may be concerns in terms of, for example, male participants tend to be less keen to take up the offer of a group. People of working age, where the groups are during the day, struggle to attend the regular appointments. And sometimes people from a variety of different cultural backgrounds feel that the group might not be relevant to their background as well. So it's really important that if we are offering groups, that we also offer an alternative to groups as well. Sometimes people struggle just to commit to the number of appointments, particularly if they're face-to-face, to engage with a traditional Tier 3 weight management service. So people may be able to commit to a couple of face-to-face appointments, but over the course of a year, it's a big commitment. And often what you see then is the attendance dropping off after the initial few appointments. And that can be related to a number of things, but also particularly travel and the costs associated with travel at the moment, which might include public transport or petrol costs, parking costs, and the time associated with travel out of all the other commitments in life, whether that's work and family life and caring commitments, can be really difficult for people to engage at the times offered with those travel commitments. And I think another big barrier sometimes is language and the being able to offer the programme in someone's first language, but also with the cultural background that matches their needs and that they feel is relevant to them in their lives. So a lot of really big barriers, which I think explains why traditionally the offer and uptake and engagement in Tier 3 weight management services can be really low in many cases. What we do at Oviva is we try to address each of those barriers to really try and drive good engagement, make the programme appealing, make people want to stick with the programme for the full 12 months. And what we see is 89% uptake from referral. And we've also seen 88% retention. So after attending the first appointment, being retained, 88% of patients continuing thereafter. And a lot of what's driven those really good uptake and retention figures has been being able to offer a choice of pathways. So we don't believe that there's ever going to be a one-size-fits-all approach. Different options will suit different people, and there's never going to be a gold standard of this is the way to offer a Tier 3 weight management service. So we offer a choice of treatment approaches and pathway approaches. So for example, our patients might choose using our Oviva digital app. And on that, they can message their dietitian at a time that suits them. Their dietitian can get back to them, for example, the next day. And that allows that asynchronous messaging allows people to fit in messaging their dietitian with their busy life and their other commitments. They might choose phone coaching, in which case we can also offer evening phone calls and weekend phone calls to try and find a time that suits people. Some people prefer one-to-one care and that really personalised, individualised care. Other people really do value a group and being among their peers and learning from each other and that peer support. So we can offer a choice of groups or one-to-one, digital app or phone or combination. And by doing that, it allows people to find a pathway that suits them, that feels like it's going to fit in with their life without us making any assumptions about what best suits a person, or there being a one pathway that's going to be the gold standard for everybody. And the same applies to treatment options as well, and especially dietary approaches. So again, we don't believe that there's a one-size-fits-all dietary approach or a gold standard dietary approach to support weight loss. There are so many different weight loss dietary approaches that are out there, and there is no gold standard. It has to be evidence-based, but something that fits in with the person's life. And our dietitians work closely with each individual to make a personalised plan that takes into account someone's goals, their background, their current lifestyle, their cultural background, their medical conditions, and finds an approach to fit with them, but that's also flexible, so that they may try an approach for a month, 3 months, and then decide they'd like to try a different dietary approach. And our dietitians can personalise that and adapt along the way as well. Another treatment approach that we offer is total diet replacement, or TDR, involving replacing all food with meal replacement shakes for a period of 8 weeks. Which can be a really intensive intervention. And again, it's not for everybody, but for those people who do engage really well with that, they see an incredible weight loss. So we saw in one of our total diet replacement programs an average weight loss of 15.6 kilograms. And seeing that level of weight loss can be incredibly motivating and can really help people to engage with what is a challenging program. And we support people really closely throughout the total diet replacement phase. And then thereafter, really closely also with food reintroduction, and then with long-term behaviour change as well, so that it's not just a quick fix of TDR, but a really effective weight loss tool followed by supported long-term behaviour change as well. And people can choose total diet replacement, or they can choose other dietary or lifestyle approaches. And if they choose total diet replacement, then that's contained within the program so that there's no cost to the participants, and that's avoiding any barriers or inequalities of access to care, so that everybody has the same access to the same treatment options within the program. And one of our really key aims at Oviva is to make the program as accessible to all different patient groups as possible. And we've looked at our weight loss data, retention data, and uptake data, and compared across male versus female, across our white background participants and our South Asian background participants, and across different ages. And we've seen very similar outcomes across all of those groups, without seeing a trend towards better outcomes in one group versus another group. Similarly, we've looked across our deprivation decile data and seen very similar outcomes in terms of uptake, retention, and weight loss across all 10 incidences of multiple deprivation data. So our aim to really break down barriers to access and see the same opportunity for each person, regardless of their background, is really key. And that's what we're driving for. And that's what we were really pleased to see those results showing the impact of that work. If you do have any further questions about Oviva's Tier 3 weight management service, or what we can do to break down barriers to attendance and optimize uptake and engagement in the program, then please don't hesitate to contact us. Thank you.
Hi everyone, welcome to today's discussion. My name is Karen Miller. I'm a dietitian by background and one of the clinical leads at Oviva. I'm delighted to be joined today by two fantastic colleagues and experts in this field, Juliet Finney and Tom Curtis. Juliet, I think you'll do a better introduction of yourself. If I can hand over to you, please.
Thank you, Karen. So I'm also a dietitian by background, and I work at Oviva as the clinical lead for our Tier 3 weight management program. And I'll hand over to Tom.
Thank you.
Thanks, Juliet. Hi, I'm Tom Curtis. I'm a medical doctor and GP by background with extended training in obesity and weight management, along with diabetes training. So, joined Oviva, having been in the NHS for over a decade. I'm really excited to be part of this kind of digital revolution.
Thank you. And it's that exact excitement that has brought us all here together today to discuss the elements which make up a really good specialist weight management service. And the more time I spend with experts like yourself, the more reading I do, the more time I spend with participants that are part of our programs, the more I realize how complex obesity is. So, Tom, I'm going to direct this question at you. What makes a good specialist weight management service?
Yeah, that's a big question, Karen, and I suppose in some ways there's maybe the answer is the same, as you could broaden that out to what makes a good health service in general, and go as big or as narrow as you want in that. I think from my point of view, and just experience in treating patients, as I say, for quite a long time now, I think almost regardless of the modality, how we interact, patients just want to have their care individualized to them and feel like they're being listened to, because everyone's got a very personal story that they present with. We learn all our facts and treatment modalities in medical school, but ultimately the patient just wants to make a connection with and establish a therapeutic relationship. And I found that I can do that as long as I've got the time and the tools. A lot of whether I'm seeing them in the building or on a phone or via an app, the patient really just appreciates me getting to know that person as an individual, and that's when I've found that the best outcomes develop. And so what makes a good weight management service, I think, is, as I say, having built in time for that therapeutic relationship to be firmly established, for the dietitians, coaches, the medics to get to know the patient, understand what they want to get out of the service, and then obviously on top of that, it's having access to the tools to treat the patient. So having access to the latest medications, having access to the latest kind of psychological interventions. And we're blessed with some wonderful psychologists and tools with Oviva. So I think it's really the individualization that I would have if I had to choose one word.
Thank you, Tom. And I think a word that really strikes me there is access. I think that's one of our challenges, isn't it? Is how do we get this care to the number of people that need it? And Juliet, interesting, one of the questions that came in pre-webinar was, what are the elements of the Tier 3 team here at Oviva? What do we provide?
Yeah, so as Tom mentioned, we aim to really individualize and personalize. And in order to do that, we have to have multiple different elements of the program, because there's never going to be a one size fits all. The different approaches, different pathways will work for different people. So we have a full MDT, first of all, which includes our specialist weight management dietitians who work alongside some specialist health coaches, and they deliver the nutritional care as well as providing guidance on physical activity during the program. And then we've got our medical MDT. So Tom leads the medical team, and they can be involved in prescribing as well as medical overview of our patients, and our dietitians can refer to the medical MDT whenever needed. So again, it's that individualization. If our dietitian feels this patient needs some medical input or review, they can refer into the MDT at any stage of the program. And then I think the psychological element is really, really important as well. And it's so difficult, I think, for people to access psychology services in the current climate in the NHS and generally, and to be able to offer psychological support to support somebody on what can be a really challenging weight loss journey is important and essential to success. And not everybody requires that, but again, it's that personalization and being able to offer that. So those are the key people elements, the medical, the psychological, the dietetic, as well as then the digital tools which sit alongside that and support the behaviour change and allow our patients to take control and self-monitor and engage with all of those clinicians at times that suit them and in ways that suit them as well.
Thanks, Juliet. And so that alone is complex. So obesity is complex, the causes of it, the actual individual who's living with it, but also at a population level, it is just so complex with so many risks for the population and the individual. But it's complex pulling all of those people together. You've just mentioned the huge multidisciplinary team that's required to deliver a good weight management service. So how does Oviva tackle some of those barriers?
And again, I think the personalisation is key, and it's obviously a real theme running through here. But there are so many barriers, I think, to engaging with a tier 3 service. And it could be that it's practicalities, it's time, it's being able to attend appointments. But it could be more around cultural barriers or fear of engaging with a programme, or not knowing what to expect, or feeling like a programme's not appropriate to you. And again, that personalisation is essential. So not assuming that we've got the answer for which dietary approach works for everybody and imposing that on everybody, but rather working with each individual to find a solution, whether it's dietary, lifestyle, a combination of all of those things that fits in with their life and their culture and their background. And that's very much the philosophy and the ethos there. And then alongside that, I think that the practicalities of being able to offer appointments out of hours, evenings, weekends, choice of, you can message your dietitian on the app, or if you'd rather speak to them on the phone, you can speak to them on the phone. Allow that choice. I think that really helps to break down those barriers, and also helps to engage with maybe people who are harder to reach or more complex as well, with complex medical background, a complex psychological background. Even people who are housebound, for example, can engage with a programme who maybe traditionally would have been unable to attend face-to-face appointments. So I think we can tackle a lot of those barriers through making adaptations and personalisation.
Thank you, Juliet. And that covers the second question that had come in, is, how do we tackle some of the, are we assuming that an app, that digital is right for everybody? And I think it's about giving people choice and allowing people to access care in a way that's right for them. And Tom, the way I woke up this morning was an announcement on the radio saying NICE had announced that the digital services, apps, would be used to deliver weight management services. Really exciting for us in this field. What are your thoughts on that, please?
Yeah, I think it's wonderful and timely news, and I think it's an acknowledgement that there is always, for the foreseeable future, going to be big capacity difficulties with the current NHS infrastructure in terms of manpower and the physical buildings if you continue with the kind of traditional models of care. And so they've evaluated the available evidence and are happy to endorse, in draft form, we should say, at the moment, happy to endorse taking forward digital technologies. I think they call it digitally enabled technologies for delivering weight management care. And that includes delivering the therapeutics, which, remember, at the moment are injectable medicines. And we've gathered quite a lot of experience now of starting patients on injectable therapies, these GLP-1s, Saxenda, for the first time. And we've done a lot of surveys internally to check that patients feel safe and well looked after with that approach. And the feedback, again, has been fantastic. Going back to that original point, where what patients really want is to feel like they've been listened to, and time and space so that they can ask their questions. That seems to be the key thing. So we had 90 to 95% satisfaction and confidence with patients starting their injectable therapies after one remote consultation. And for those who don't, we come up with another solution. So, I'm not going to say that this is the right solution for everyone, but I think NICE acknowledge, and it fits our experience, that it's probably the right solution for a good proportion, if not the majority. And that has implications in terms of the cost models. I think remote digitally enabled care can be lower cost because we don't have buildings to maintain in the same way. And then it frees up capacity elsewhere in the NHS for things like surgery. And, there's unavoidable big buildings and expensive infrastructure that you can't physically do some things without. But yeah, really exciting development. It hopefully opens up these new medications and the other things that we do, like total diet replacement, and for a bigger swathe of the population. I suppose it's also slightly strange talking about this. One, the guidance is in draft form. Two, we've also had an announcement that the drugs are out of stock, but that's a temporary thing. But it also, I think, highlights the need for a very broad multidisciplinary team. So, you know, if I was lucky enough to be under Juliet's care, she would be able to offer me a total diet replacement, which has almost, if not slightly better actually, weight loss on average than Saxenda therapy. Whereas a lot of tier 3s, there's no standardized menu of options. We just happen to have just about the most extensive of any tier 3 can offer at the moment. So yeah, exciting is the takeaway, and it'll be interesting to see how this develops over the next 12 months. But we've been forerunning and kind of ringing this bell for a long time, so it's nice that others, including NICE, are catching up with us.
Thank you, Tom. And none of this is a magic formula, is it? Being on an app doesn't mean you're going to lose weight. Taking GLP-1 doesn't mean you're going to lose weight. But all of these tools might really support someone in their journey and make that weight loss that little bit more possible. And Juliet, final question, just to close our thoughts today, is that the reason people are referred to us is to lose weight. But that weight loss is then linked with so many different health outcomes. Now, one of our questions was, how do we measure success? Should we only measure success on the scales?
A really, really good question, Karen, and a really important question. And I think traditionally we've always looked at the numbers on the scales because they're easy to measure and it's easy to compare outcomes between different people, but there's so much more to it than that. And a lot of the reasons why people might join our program or a tier 3 weight management program in general is not about the figures on the scales. It's about their overall health. It's about their well-being. It's about their psychological health. It's about their quality of life. It's about what they can do, and which is so much more than a number on the scales. And when we reduce it to that, then we're missing so much of the potential benefits and the life-changing impact. So how do we measure these other things? It's much harder to measure and much less standardized, but we should and we can and do measure parameters such as confidence, how confident somebody's feeling, and their long-term tools to manage their health. We can look at psychological health, so we can look at measures of psychological well-being, depression and anxiety, and see those figures improve throughout the context of the program. We can look at patterns such as binge eating behaviour, and there are validated tools that we can use at the beginning and the end of the program to see reductions in binge eating behaviours throughout the program. So I think all of those things can be really powerful, as well as general quality of life measures. But as well as that, I think just the feedback that you get from somebody who's doing a program, who'll just give you verbal feedback on the changes it's made to their life, the fact that they can run around with their grandchildren and they couldn't do that a couple of months ago. Those sorts of things are incredibly powerful to the individual. And I think when you build up that good therapeutic relationship between the dietitian and the participant on the program, you hear those stories and you can gather that feedback and get that real life insight. And it's a measure of how well that therapeutic relationship is going as well.
Thank you. And I think your answer just shows how that one-to-one care, that connection, which loops right back to the way you started, Tom, is absolutely crucial in delivering not just an effective service, but one that's really safe for that individual. Tom and Juliet, we've run out of time. Thank you so much for a really interesting discussion. And thank you everyone for joining us.
Thank you.
Thank you.